cheaper than a massive health insurance policy. I mean, how many times do you go to the doctor? You know, some people more, some people less, but it drives the cost down. Tort reform, the second tenet in our plan. Keep doctors and other healthcare providers in the operating rooms and the delivery rooms rather than in the courtrooms. You know what's happened in Texas? In Texas, it's difficult to get a license to practice. It's not because it's an onerous bureaucracy. It's not because it's overregulated. It's because the line is so long. They've implemented tort reform in Texas, and physicians are flocking to Texas to set their practices up there. Tort reform that lowers malpractice insurance costs and let doctors have more flexibility and not have to be so defensive and run tests that aren't necessary in order to protect themselves and mitigate that perceived liability. We all win. It drives costs down. One of the final tenets is competition. America was built on the innovative spirit of a private sector economy where one guy says, hey, I'm going to raise the pigs, and one guy says, I'm going to raise the corn, and I'll trade you corn for pigs. And another guy says, well, I can raise pigs better than this guy can. So I'll give you a better deal for your corn. I'll give you more pigs because I can do it better. Competition began to emerge. That's what happened back in the 1700s. Today, we need those insurance companies to have to compete for your business. Not just assume that you're a captive audience. Make health insurance portable from state to state and job to job.
And I guess part of my concern was that with turning Medicare over to management kind of companies, we were creating the same problems that already exist, you know, in that.
Well, we're not talking about turning Medicare over to management companies. We're not talking about privatizing Medicare.
Functioning like management.
No, we're not talking about privatizing Medicare.
Okay.
That is not what we're saying. We're talking about providing and giving all Americans, 54 years of age and younger, the ability to choose from Medicare certified insurance providers.
Now, doesn't that already exist?
At cost, but they're Medicare certified at cost cheaper, but they also get premium support. That's where the difference comes in. They get premium support, where the wealthy gets less, the poor gets more. That's the basic tenets of the program that we have supported. Now, there are a couple of other things in the health care law that we think need to be considered in a new revised health care law. Pre-existing conditions. I think it's a good thing that insurance providers cannot deny coverage for pre-existing conditions. Many Americans don't have a choice in the health condition that they're in. They didn't ask for the diseases that they have contracted or the birth defects that they were born with, but they've got that. I also believe that in this economy, where half of our college graduates are either unemployed or underemployed, that it's a good thing that they can stay on their parents' health insurance policy until they're 26. Shouldn't be mandated, but families ought to have that option. Yes, Dr. Meeks.
I'd say quite a few years ago, sitting in rooms like this, there were a lot of people who had concerns about the high cost of prescriptions. I mean, I would hear, even more so than medical bills, it was the high cost of, how can I afford to choose between food and drugs? Are you hearing that problem now? Because I'm not.
I'm not hearing, I'm not hearing that problem a lot, but I will tell you that when competition goes into the system, right, we'll see that issue go, it will begin to be addressed too.
What fixed that problem? I think it was like when people like Walgreens, I mean, what I heard is like you can get more generics, You know, I don't think people are going to Canada. I think that was solved by competition. I think there was one. I think some people like, I remember when Walgreens and Walmart said, you know, we're gonna provide this drug, and they drove the cost to $11, and I think it made the drug companies saying, oh well, we don't want that to happen. So I don't know, but somehow that problem got solved.
Yeah, well, you got two sides, and I think you just highlighted it. You got two sides of the drug resource issue. You've got the big drug companies that put all the billions of dollars into research and development to develop new drugs. And then you've got the generic companies who take the formulas that were developed over here and they create the generic drugs after the patent time period expires over here. I mean, absolutely there's been tremendous competition. The problem that these companies are facing is where are they going to get their R&D dollars from in this kind of economy? How are they going to develop new drugs when they're struggling under the same kind of oppressive regulations and healthcare cost mandates by the federal government that other businesses are? These companies are putting out fewer. You see what I'm saying?
Yeah, I didn't know that.
I mean, that's the kind of economy that we're creating. That's being created by this healthcare law. It's not good for them. Yes, sir.
That pre-existing segments in your healthcare bill, that don't kick into what, 2013?
I think the pre-existing condition kicks in 2014.
I think it's
14.
If I went out and shopped for insurance now, because I have to.
We'll get you an answer back on that. I want to make sure we're right. I don't want to quote 2014 unless we're absolutely certain, but we'll find out for you.
If I went and asked for, say, alcohol, because I got a shop now for someone to cover my half the Medicare and my supplement, can they deny me right now?
I don't know. We'll find out. We'll find out.
But I've got pre-existing. I have that.
We'll talk about it later. Who else has a question? Yes, sir.
Being employed by Charity Hospice, and we've got several of our employees here, and one reason we did contact you to be here, one of the concerns we have, we are a faith-based organization, and our beliefs are on that level of care. We're a small organization, like so many others, and I know that everybody knows about the controversy going on about the abortion issue tied in with the health care law. What concerns me is what is in the works for us as an organization and individuals who are strongly opposed to this. Are we going to have this forced on us? Because again, as I read and I try to find out what's going on, there's so many waivers being given out for certain things with this plan. Are we going to be able, or what are we going to be able to do if our employer says, hey, listen, I don't believe in this. We're not based on this. Why should we have to support something that we're dead against? And I mean, you know, so I know there's some things in the works. I don't know what your plan is down the road. What we have to fight this with, you know, because again, it affects us all. You know, can our employer say, hey, you know, I'm not going to have this insurance. I mean, I'm not going to pay for something that I don't believe in. And of course, are we going to have to be, you know, paying penalties and taxes and whatever they want to call it? It's not fair.
Sure.
And
it is not fair.
It's not fair. And then one more question while I'm talking about this. Of course, hospice directly is involved with Medicare. That's our lifeblood. That's what keeps us, pays our paychecks. And again, I've read in this health care plan and parts of it that our specialists, our oncologists, the doctors that are directly service us, their fees are going to get cut tremendously. Those people are not going to want to service us anymore. What happens to hospice down there? What happens to the organization that's out there to help people?
Remember that panel of unelected bureaucrats I talked about in Washington, D.C.? They're going to be the ones to determine what access and what health care people are able to get when the shortages begin to emerge. And you're exactly right, the shortages are coming. Remember, 1 in 3 healthcare providers are saying no more Medicare patients, limiting the number of Medicare patients.
Well, we've already, our company here just recently experienced where we had to go and send paper and paper after paper to Medicare to prove that our patients are worthy even us taking care of them. And in a small organization, it cost us money. We had some of our payments held, our money that's coming in from Medicare held for months. And all we're doing is trying to make quality of life better in the last days of people's lives. And this is something that I think people need to be educated on a lot more than what's going out there. And unfortunately, our mainstream media just doesn't promote that enough and doesn't educate the people. And I think that's some of the problem we do have. I think people are not educated enough, and they don't understand that when the roof starts caving in, we better all get out of the way.
Steve, that's why we spend so much of our time doing these types of forums, all up and down the district. I had several of them last week. Had another one this morning with the senior center. Met with a charity hospital group, or charity clinic group here in Steubenville today. I want to answer the first question. What do you do about the health care law stepping on the religious freedoms and convictions of all Americans? Doesn't matter what you believe, but they're telling you what you can believe, because they're forcing you, regardless of what you believe, to purchase insurance that has these elements in it. You know, right over here, Franciscan University was the first university in the nation to say, we're not doing it. We'll see what the administration does when they come up against that enforcement issue. But back to your question, what do you do? It's 2 very simple answers. Repeal the President's health care law in its entirety. Do away with it. Stop the religious stepping on our religious freedoms. Stop the individual mandate. Stop the $700+ billion cuts to Medicare. Stop all those other taxes that are going to be coming on the American